I have a request. Please, if you DM me and want to discuss a case, and that happens a lot, you've done a root canal and patient still has issues, problems, and you want to discuss the case with me and figure out what's going on. Please don't just send me the x-ray and say, I did this root canal on this patient continues to have symptoms. I have no idea how you did the root canal. You need to explain to me how you did the root canal. And the most important thing is I need to know is, did you use a rubber dam? Did you follow all the fundamentals of endodontics? What are the fundamentals of endodontics? I'll cover this ad nauseum. Rubber dam, a sealed rubber dam, is a fundamental of endodontics. Let's back up. Let's back up. Diagnosis is number one in fundamentals of endodontics. Proper diagnosis. Did you properly diagnose this case? Was the tooth that you diagnosed to be the problem tooth, was it diagnosed properly? Do you have documentation of the tooth, the condition of the tooth to start with, the patient's symptoms, percussion test, palpation test, vitality test, probings? If you saw any cracks or crease lines, proper radiographs. Do you have multiple angulation radiographs of the tooth? Or for some of you guys who take a CBCT, were you able to read the CBCT properly? Did you discuss all of that with your patients? Was all of the information that you collected during the consultation visit, were you able to relay all of that to the dentist in a language that you to the patient in a language that the patient would that the patient understands? Did you document all of that? Did you document all of that in the patient's chart notes? Did you get the proper consent form signed, initialed and signed by the patient? It all starts with that. Some of you guys, patient comes in and says, this tooth bothers me. You sit him down, give him an injection, start drilling. So please pay attention to all of this. So it all starts with proper diagnosis and documentation, proper testing of the tooth, making sure if a patient comes to me complaining of pain on the lower right side, I never start with examining the lower right side. I start with examining the upper right side. I want to rule out referred pain. So upper right side and vice versa. If a patient points to a specific tooth, I don't start testing that specific tooth right away. I need to get a baseline, so I test the tooth on a different side. If a patient comes in complaining of pain on the lower right side, and I've tested the upper right side, I don't go right away doing a vitality test on the tooth that the patient is pointing to, because I want to get a baseline for that specific tooth. So I go to the left side and I test the exact same tooth on the left side. Let's say with vitality, with cold test, percussion. So I have a baseline, and then I go to that side and test that specific tooth. So those are the things that you need to pay attention to. So let's say you've diagnosed the correct tooth, you know what the problem is, you've gotten the consent form from the patient, and my consent forms usually are never prognosis is good. I write that. I write the prognosis, that I discuss the prognosis with the patient, because there's so many different variables involved. We're not changing a fuel pump in a car. We're working in the mouth, one of the most hostile environments of the human body. We're working on a tooth that's been through so much throughout the patient's lifetime, endured so much, chewing forces, torque, grinding, clenching, biting down and chewing on bone and the stuff in the food. And there's so much going on. Plus, as I said, the mouth is a really hostile environment. We got saliva. We got foods all kinds of foods with all kinds of different pHs that the patient consumes. We got bacteria, we got viruses, we got fungi, all kinds of stuff that live in the patient's mouth. And there's certain things that we don't see. Let's say the tooth has micro cracks in it. We don't see that, even if we use a microscope. Even if you take a CBCT, you can't see micro cracks. So it's important that you tell the patient that the success rate for endodontic treatment is not 100%. The patient needs to know that. The success rate for endodontic treatment is not 100%, even if you're starting with a vital pulp. The success rate is not 100%. Patient needs to know that. If you give the patient the impression that the root canal has a 100% success rate and something goes wrong, and patient comes back and they're still hurting, the tooth hurts, they say, this tooth never hurt like this before. What you did made the tooth hurt and make my pain worse. But if you've already discussed with the patient that the success rate for the endodontic treatment is not 100%, then you've prepared this patient mentally for perhaps unfortunate things that can happen. So it all starts with getting a proper consent and discussing all of this with the patient. Make sure you always tell the patient the success rate for endodontic treatment is not 100%. It's close to it. It's 90% and more, but it's not 100%. There's no such thing as 100% success in medicine and dentistry. No such thing. Because, as I said, human body, it's alive. There's so many different variables going on. It's not a car that you say the water pump is bad, you change the water pump and that's the rest is fine. There's so many moving parts. There's so many different kinds of things that goes on in the human body that we sometimes have no control over. So all of this needs to be discussed with the patient. So if something happens, something unfortunate and something that we did not expect, then we can always tell the patient, remember, we discussed all of this. I'm gonna try to address the issues. I don't dismiss the patient and say, hey, you're on your own. I told you so. You're on your own. I still try to help the patient, but then at least I've already discussed with the patient what can happen, the possibilities, risks, etc. So now the patient is prepared. All right. So make sure you discuss everything with the patient before you start drilling. Just start drilling on the tooth. So when you sent me a case, when you want me to kind of figure out what's going on, I need to know if you've used the rubber dam, if you follow the fundamentals of endodontics, if you've done proper diagnosis and consent and all that stuff. I need to know all of that. Because I'm just going to assume you didn't use a rubber dam. I'm just going to assume that you didn't use 6% sodium hypochlorite. I'm just going to have to assume that you didn't follow basically the fundamentals of endodontics that I talk about ad nauseum. So please make sure that you do all of that.